with Dr. Benita Zahn.
If anyone says this last year hasn't been stressful, well, I'd ask, what rock are they living under? But how we've dealt with the pandemic stress varies greatly based on our lives. You know, do we have kids? Do we have parents who we're taking care of? Are there jobs that remained or disappeared? Well, May is Mental Health Awareness Month. Mental health awareness is much more enduring than just a month as we work our way back to normal. And to help us do that and recognize where we may be struggling, well, I'm happy to welcome Dr. Kristen Navarette. She's Medical Director for MVP Healthcare, and also Dr. Dawn Gonsalves, Medical Director and Psychiatrist at MVP Healthcare. Ladies, thank you for joining for this. And you know, stress, anxiety, they can manifest both physically and emotionally. Are we aware of that? I know we may feel, mentally, fatigued, dragged down, but do we understand the physical manifestation of all this?
Yeah, that's a great question, Benita. And we do. We know that stress affects our physical health. We know that when we talk about wellness, it's not just about our heart. It's not just about our immune system. We know that everything is connected, and our mental health and wellness is just as important as our physical health, as they contribute to each other. So if our mental health is not well, we're more likely to have physical health problems. And we know if we have physical health problems, we're more likely to have mental health problems. So the two are very closely connected. And it's important that we give attention to both of them, especially in these really difficult and stressful times.
What kinds of physical manifestations should we be alert to or recognize if we're already experiencing them?
Yeah, so there are lots of different ways that our body can manifest stress that we see in our physical health. One of them is our heart health. We know that people who are stressed tend to have higher rates of high blood pressure. They may also have higher rates of high cholesterol and higher rates of obesity. So we see all of these various health effects, particularly in individuals who carry a lot of stress. And one of the reasons is because it's difficult to put ourselves first and our health first. It's difficult to get into the doctor for our regular checkups. It's difficult to focus on diet and exercise. And so all of those things end up being seen in the physical health.
Dr. Gonsalves, is this tougher for men or for women? And I'm going to suspect it's women that taking care of self, because traditionally women are the caretakers for everyone else.
Yes, I think that I would agree. I mean, especially during this time too, during the pandemic, working from home, moms working from home, taking care of children who are attending school virtually or children who are not. So these are added stressors for mom, in addition now to having to social distance. Moms really typically put their own health on the back burners when firstly taking care of the health of their family members.
And Dr. Gonsalves, look, kids may manifest, they get pouty, they may, throw tantrums, but how do we suss out if it's something different, that it's been triggered by this odd time we're living in? How do we make that determination in our kids?
Sure. I think that, we know our kids, and if you will, we know each other. We know what's typical behavior. And when the behavior is atypical, or when it appears more intense than usual and lasts for a longer time than it normally would, you might consider that there's something more there.
And, I know it said the adults need to be modeling positive health behaviors, but how do we do that if we're struggling, if we're hurting?
Well, I think that, we need to, if you will, speak to our loved ones, people we live with, even colleagues we may feel close to, about the stresses related to the pandemic. And, feel free to be able to say, I feel stressed, I feel anxious, and be able to feel comfortable to talk with people that we love about those feelings, so that then we can feel more comfortable to be able to model them for our children.
And let me ask both of you, we've seen and heard so much about people who have put on the COVID-15 or 20. They've taken to drinking more than they ever have. And we know that substance abuse has skyrocketed, not only for those who had been dealing with it before, but there are new cases as well. And then you've got that whole issue of stigma around mental health. So put all that into the mix. How do we begin to tackle this, especially with that stigma hanging over us?
Well, I think that the stigma during this time of the pandemic has lessened because so many people feel more anxious, more stressed. And I think that you're right in terms of the use of substance use, either people who have never used substance starting to use substances, or people who have maybe occasionally starting to use more substances. So it would definitely be a good idea to speak, to your family, to speak to your primary care physician, and reach out for help, for treatment.
Yeah. And Dr. Navarette, before we let you go, you ladies, great information. If you could write a prescription for us now in this trying time, and also the struggle some are having getting back into the social situation, what would that prescription look like so that we could re-engage in a healthy fashion?
That's a great question. So I would definitely recommend that everyone reach out to your primary healthcare provider and start a conversation with them about how to get back on track with your health goals. Reach out to your family and your friends, as Dawn was mentioning, to get reconnected back with them, and really just reach out and ask for help. I think sometimes that's the hardest thing for us to do. We like to shoulder a lot of our burdens on our own. And the most important step is to take that first step to just ask for help and reach out.
Yeah, it's very hard to say, I need help. Nobody wants to look as if they're weak. We worry somebody will get one up on us, and the only one we need to take care of here is ourselves. And I'm sure if we're members of MVP, you folks have a hotline that they can call. There are services to reach out to, correct?
Yes, definitely. We do have a care management program, and it's at 1-866-942-7966. You can speak to a licensed behavioral health clinician about what you may be experiencing. And we have over 4,800 behavioral health providers that we can refer our members to. And we also have an online app for telemedicine. It's called My Visit Now, where services are available 24 hours a day, 7 days a week, 365 days a year.
And that's the key. You got to pick up the phone when the moment hits. Don't put it aside. Ladies, thanks so very much, doctors. I really appreciate your time and your expertise. I want to thank all of you for joining us. And I've linked to some mental health support services, including the New York State Office of Mental Health. You'll find all that under links on the WNYT webpage. Till next time, be well.